So looking at the anatomy and physiology, so we're going to be going through the entire endocrine system. And one of the things you're going to see is obviously the running theme is that we're dealing here with the hormones in our body. Okay, so hormones are essentially complex proteins that get secreted, and they produce actions of an organ system, or they inhibit actions of an organ system, or they even possibly stimulate other hormones. There's very complex interaction between what goes on with the hormones in our body. The endocrine system also works very closely with our nervous system. As you'll kind of see throughout the discussion, you'll see some links between the endocrine and the nervous system. So we're also going to be talking about, with this metabolism, so the biochemical functions and interactions of the organs of the body system. So there's both internal and external factors that affects our metabolism. So your internal factors are obviously, for instance, your hormones, because there's going to be hormones that get secreted that impact your metabolism. But then you have your external factors. So things like calorie intake, your macronutrients, water, vitamins, minerals, things that you look at with basic nutrition that also impacts your metabolism. Okay, so we're going to be looking at the anatomy and physiology here related to the endocrine system. So we're going to be looking at the various endocrine glands. And again, you're going to see that there is a very common link between the nervous system and the endocrine system. So if we look at the hypothalamus, for instance, so the hypothalamus is responsible for communication with other organs, particularly the posterior pituitary and the adrenal medulla. From a hormone perspective, it produces two hormones. It produces antidiuretic hormone, also called vasopressin, and oxytocin, both of which get transported to the posterior pituitary to be released into the bloodstream. Okay, so it actually sends both of these hormones to the posterior pituitary, which that takes us to the pituitary gland. So the posterior pituitary then is going to secrete the antidiuretic hormone and oxytocin, and then the anterior pituitary is going to secrete growth hormone. And again, we'll expand on more of these later, but I'll talk about some of them here. So growth hormone is responsible for protein synthesis, tissue growth, increases the use of fats for fuel. You have your thyroid stimulating hormone, which is going to stimulate thyroid function. And you have adrenocorticotropic hormone, which is going to be responsible for stimulating the adrenal cortex. So it's going to stimulate the adrenal cortex to release your glucocorticoids and your androgens. And again, this picture is going to commonly pop up, so you could kind of see what we're talking about. So if you look up here, we're obviously looking at, you have your pituitary gland, and then your hypothalamus would be up here in the brain within the central nervous system. So as I had said, there's going to be a lot of communication between the nervous system and the endocrine system as we look at the function of this particular system of organs. Okay, so continuing to look along, the pituitary gland is going to be secreting a few more hormones. You have follicle stimulating hormone and luteinizing hormone. Both of those regulate the secretion of hormones from the ovaries and testicles. You have your thyroid gland, which is going to secrete thyroxine, triiodonothyronine, and calcitonin. So when we look at those hormones, so thyroxine and triiodothyronine, okay, or T4 and T3, they're going to be responsible for increasing metabolism, protein synthesis, and just general growth and development. Calcitonin is actually going to decrease the demineralization of bone. So when your calcium levels are where they're supposed to be at, calcitonin will be secreted to decrease the calcium that you'd be taking from your bones. So when your blood calcium drops, your body will look to kind of steal calcium from your bones. So that's one of the reasons why you want to make sure you have good dietary calcium intake. But in the case of calcitonin, it stops that process. Now, just the opposite of that would be at your parathyroid gland, you have parathyroid hormone. So parathyroid hormone increases calcium in blood by demineralizing bone. So if your blood calcium does drop, parathyroid hormone is going to be responsible for taking that calcium away from the bones. And then again, here you have we'll keep flashing up the anatomy here. So you can see the thyroid gland up in here, and that would be your anatomical location. Okay, so continuing, we look at the adrenal glands. So at the adrenal glands, you have two different parts. You have the adrenal medulla and you have the adrenal cortex. So the adrenal medulla is responsible for secreting epinephrine and norepinephrine, and those two particular hormones are very closely related to what goes on with the sympathetic nervous system. So epinephrine is responsible for part of your stress response. So it helps to increase your heart rate, blood flow to muscle. It actually decreases blood flow to your internal organs. It increases glycogen breakdown and also the release of lipids from your adipose tissue. Your norepinephrine is responsible for vasoconstriction. And this is your adrenaline, what we call adrenaline or noradrenaline as well. Your adrenal cortex is going to be responsible for secreting aldosterone, cortisol, and testosterone. So aldosterone is going to be responsible for increasing the absorption of water and sodium ions in the kidneys. Your cortisol is going to be involved with the stress response. It actually does suppress the immune system. It's responsible for raising blood glucose and also has anti-inflammatory effects. There is also a small amount of testosterone, which also gets secreted from the adrenal cortex, and that's going to be obviously important as far as like secondary male sex characteristics, increasing protein synthesis, and some other things related to the male reproductive system. The pancreas is going to be responsible for secreting glucagon and insulin. So insulin is going to help increase glucose out of the blood and into the cells. Glucagon will actually break down glycogen in the liver and help release that glucose from the liver into the blood, and also helps to release fat stores. Your ovaries are going to be responsible for producing estrogen and progesterone. Again, that's from a female perspective, your secondary female sex characteristics regulates the menstrual cycle, talking about estrogen here, and inhibits luteinizing hormone release. Progesterone actually prepares the uterus for the implantation of the egg, and also the secretion, the secretory function of the mammary glands. Testosterone from the testes, again, that we talked about this a little bit earlier. So, again, the reason why males have significantly much more testosterone than females is because of the testicles. So the testes are going to produce testosterone. Again, your secondary male sex characteristics, again, increase protein synthesis, increase sperm production, and also inhibit luteinizing hormone release. So females are going to get a little bit of circulating testosterone, and that's primarily going to come from the adrenal glands. So again, there you have your outline as far as your anatomy is concerned. All right, so looking at the regulation of the body's energy, so we know that obviously, part of the whole discussing the endocrine and metabolic system, we look at how the body derives its energy. And again, as we've talked about before, our main energy source and our easiest energy source is going to be our glucose, which is going to come from our dietary carbohydrates. And the endocrine system is going to be responsible for helping to maintain normal blood glucose levels. And as you can see here, we have our hormones that are present in order to do this. So when glucose levels kind of exceed the need for fuel, insulin is going to come in and basically take the excess glucose out of the blood and store the excess glucose in a couple different spots. It's going to store it in the liver, the muscles, and also even to a degree the adipose tissue. So insulin is going to be responsible for lowering our blood glucose, and then we have what we'd call our insulin antagonists, which would be your glucagon, epinephrine, norepinephrine, and growth hormone, and they are going to be responsible for releasing glucose from glycogen stores, promoting what's called gluconeogenesis, which is going to increase our blood glucose levels. So we have our breakdown as far as what's going to drop blood glucose levels versus what will make our blood glucose levels increase when we need it. Now, obviously, dealing with an active population, we have to understand how exercise impacts that. So with exercise, our bodies don't need as much insulin. However, we also need glucose. So the insulin receptors on the muscle actually have increased sensitivity. So individuals who actually are just consistently physically active, they have a much better insulin sensitivity because they don't need to use as much insulin in order to uptake blood glucose, because those receptors on the muscles become more active as a result of exercise. As a matter of fact, strength training in particular really decreases an individual's need to use insulin for that reason. And then we have obviously the epinephrine and norepinephrine, along with growth hormone and cortisol, which also further inhibit insulin production. So obviously, when we exercise, our bodies don't need as much insulin because of the fact that we're utilizing our energy. So these hormones that we talked about are actually going to inhibit insulin production, and it's going to further allow us to get more glucose when needed from the other storage sites. All right, so regulating body temperatures, again, all your normal metabolic processes that you have are going to basically create a certain amount of energy at rest, and it's going to be dissipated as heat. And that's kind of where our ideal body temperature of 98.6 degrees kind of comes from. Now, again, when you're exposed to various things, environmental conditions, exercise, that's obviously going to kind of push your body temperature around, but your body looks to kind of maintain that 98.6. So we look at the various ways the body looks to do this. One of the ways it gets done is through the hypothalamus secreting thyroid stimulating hormone. That would be to either increase or decrease the metabolism, depending upon whether the body temperature seems like it's dropping too much or rising too much. That would impact the levels of thyroid stimulating hormone. Again, based upon whether you're looking at cold and heat. Obviously, with exercise, your core temperature is going to rise. And then through another thing that's going to assist with maintaining that is your sweating mechanism. So your heat dissipating functions are going to begin once your core temperature starts to rise. And eventually, ideally, what happens is you start to reach a steady state. So between your hormone production and your sweating, that's going to help to maintain your body temperature while you exercise. So body fluid regulation. So here we look at antidiuretic hormones. So the antidiuretic hormone is going to be produced in the hypothalamus and secreted by the pituitary gland. The whole purpose of antidiuretic hormone is to retain water. So it increases the absorption of water at the kidneys, and that's going to cause a decrease in urine volume. And in particular, you'll see this when you exercise because of the fact that your body's trying to hold on to as much fluid as it can. And again, maintaining hydration inhibits the secretion of this, which it would make sense. If you're maintaining your hydration really well, obviously your body's going to have to excrete fluid. So maintaining hydration will actually inhibit the production of antidiuretic hormone. So we look at the hormonal response to exercise in general. Again, there's going to be the release of certain hormones when it comes to exercise or any other physical stress for that matter. And what's going to happen is over time, with adaptation, with higher conditioning levels, you won't get as big of a response from some of the hormones. Now, there are some hormones that there are some hormones that get released that they don't go through any adaptation process, and we'll mention some of those. But for the most part, your endocrine system will adapt to exercise just as your musculoskeletal system, and cardiovascular system adapts. There's a certain degree of adaptation, particularly when you get into higher conditioning levels. And there's some particulars. So with intense exercise, particularly intense resistance training, you get an increased release of growth hormone. Cortisol is actually increased with endurance exercise, and you actually get decreases in growth hormone. So that should kind of make sense. I always say when you kind of compare and contrast like a 100-meter sprinter with a marathon runner, you notice that the 100-meter sprinter has a lot more muscle mass to them than the marathon runner does. And again, that's a part of the adaptation to the activity that they're doing. With long duration endurance exercise, the body releases more cortisol, which is actually a catabolic hormone, so the muscle mass doesn't increase as much, and you don't get as much of the effects from the anabolic hormones. And the one I had mentioned this there's no adaptation when you begin with the onset of exercise. Your catecholamines, your epinephrine and norepinephrine are going to increase with the onset of exercise, and there's no adaptation to that. And if you think about it, it would kind of make sense that they're your, a lot of the, and there's a couple others. These are your primary ones, though. If you think about what epinephrine and norepinephrine do, in as far as their response, for instance, what goes on with blood flow and heart rate and everything, you need those things to happen with exercise. So you certainly wouldn't want an adaptation to occur there, because again, with the onset of exercise, those particular hormones need to be released in order to get the appropriate physiological response. Follicle stimulating hormone and luteinizing hormone, those are going to get depressed with intense exercise as well. So you'll get decreased secretions of estrogen, and to a lesser extent, you'll get decreases in testosterone. That's why it's important, particularly with young female athletes, to make sure that there's no nutritional deficiencies, particularly if they're going through intense exercise, because of the health issues that could come about with problems with their reproductive system. And then your neurotransmitters, they're going to get released with exercise, particularly with exercise of moderate to high intensity. So you have your endorphins, which we didn't talk a whole lot about, but they actually produce a mild analgesic effect, which alleviates muscle pain, and it also looks to counteract the increase in cortisol that you can get with exercise, which again, we know that cortisol has effects that could bring about some issues associated with physical stress. And again, the other thing is that the endorphins also look to stimulate lipolysis, which is the breakdown of your stored fat, and also they help to provide carbohydrates to your working muscles. So your signs and symptoms that you start to see, and you're going to see a lot of different signs and symptoms that come about with the endocrine system. If you think about it, the endocrine system is kind of a thing where there's various functions in the body that get affected. So we're just going to kind of go through some of these. You have your skin changes. Again, there could be changes in the color of the skin, the texture, the appearance, the flexibility, the textures. So that would be something to note as a result of the endocrine. Diaphoresis and hyperhidrosis. So this just involves sweating, or in the case of hyperhidrosis, excessive sweating. So obviously that could tell you something where someone's metabolism could be overactive. Body and breath odor. For instance, high blood glucose levels without sufficient insulin could produce like a sweet odor on the breath. We'll mention that when we're talking about different issues that come about with diabetes. And again, metabolic breakdown of certain things can actually cause odor on the breath or the body, depending upon what that particular substance would be. Polydipsia and polyuria. So polydipsia is excessive thirst. Polyuria is excessive urination. And again, there are certain hormones that would be impacting that. Arthralgia and myalgia, so joint and muscle pain. Muscle atrophy and weakness. Amenorrhea and impotence. We know that obviously there's ramifications with the reproductive system in males and females. Confusion and mental status changes. So again, endocrine and metabolic issues can affect your cognitive function. And we had talked about the working relationship between the endocrine system and the nervous system. Again, here you have another neurological sign and symptom, but again, could be related to the endocrine system, because the endocrine disorders and metabolic disorders can cause damage to nerves. So you can get paresthesia associated with that. Edema and pitting, if you get excessive extracellular fluid with certain disorders, or water retention. Polyphagia, which would be excessive intake of food, increased hunger, and again, that could suggest an overactive thyroid, something of that nature, when a person's taking in a lot of food, not gaining any weight. Postural hypotension. So because of the endocrine system regulating the fluid in the body, an individual could develop postural hypotension because of issues regarding fluid retention or loss. And then just fatigue in general. So lethargy and fatigue can be caused by the endocrine and metabolic system because of its relationship with allowing the body to produce energy. So with pain patterns, again, as we're kind of going through the history here, if you have issues with the hypothalamus and pituitary, you could be looking at headaches and visual disturbances, particularly with the pituitary gland in the close proximity to the optic nerve. The thyroid and parathyroid, you look at the anterior and inferior aspect of the throat and neck. So you'd look to palpate the thyroid to see if there's any enlargement just right at the neck with the neck and extension. Your adrenals can cause widespread pain, and they could kind of spread out into the joints and muscles. The pancreas typically will be in the upper left quadrant, or you'll have your individual complaining of generalized epigastric pain. So further looking at our examination, one thing to note with the exam is a lot of these disorders do have a strong genetic component. So if if in an assessment of an individual, you do have a belief that you're through the signs and symptoms they describe. If something seems like it could be one of these disorders, you could ask, is there a medical history in the family of any particular type of disorder. As far as your physical exam, again, look at the signs and symptoms described, and that could kind of guide you as far as what you'd be looking for. For instance, if you're worried about something with the thyroid, and many times if the thyroid, for instance, is enlarged or there's an issue, you can actually kind of see that. But obviously, you can further palpate that. So an enlarged thyroid gland is also called a goiter, and that could tell you that there's a pathology with the thyroid gland. Another very common thing to be doing is obviously measuring blood glucose levels. We're going to talk extensively about diabetes. Here you have your various, normal, your fasting and postprandial or after you consume food, what the blood sugar levels should be. Urinalysis is another thing that could kind of assist with looking at the screen for glucose and ketones. Now, ketones are a product of fat metabolism, so when blood glucose levels tend to get excessively high, glucose is also going to spill into the urine, and then the presence of ketones is going to give you, particularly with your diabetes patients, that they could be having an impending ketoacidosis, which that needs to be dealt with very promptly. Just another thing, I don't have anything up here on it, but it's just noting is that obviously core body temperature would be something, particularly when you look at exercising in the heat and assessing for heat illness. Again, the gold standard is a rectal temperature to get the most accurate measurement, and you could use the special thermometer. There's a rectal probe that can be used. And again, basically, you could read in your textbook about the technique for that. Again, if you get into the rectal temperatures of 104 to 105 degrees, that's going to start to indicate your exertional heat illness, and you're going to want to do your immediate cooling at that point. And while you're doing your immediate cooling with your full body immersion, you're going to want to make sure that you are still monitoring the body temperature, because you want to make sure that you don't overcool the athlete. You typically want to cool them down to about 102 degrees, just before they get transported to the medical facility.